Hello, my name's Laynette Ryrie and I'm from Canada. Last March, I was diagnosed with osteoarthritis in both my hips. I was told in June and September last year that I would have a 2-year wait in Canada before I had surgery on one hip. So I did some research on where else I could get surgery done, and I sent requests to several hospitals in India. Fortis Hospital was the one that responded, and they responded quickly and answered all my questions. I wanted a hospital that was good in hygiene and also the quality of care and things like that. Excellent physician, and Fortis has been all of that. I came and I had my one hip repaired in November. The other one was 7 weeks later in January, and I saved 2 years of my life because I felt if I had to wait another 2 years, I'd have more problems. The hospital, the staff, from the housekeeping to the doctors to the nurses, everyone has been excellent. My doctor's name is Dr. Mohan Puttaswamy, and he is excellent. I can't say enough good about him. If you're considering having some hip replacement work or any kind of bone work, like knee replacement, I would highly recommend Fortis Hospital in Bangalore, India, and I would highly recommend Dr. Mohan Puttaswamy. The entire staff was excellent. I've had excellent care. When I came here, I couldn't walk alone. I had to have cane, or I used my hiking poles, and I had to grab onto things as I walked because I could not walk by myself. I could not carry anything. There was very severe osteoarthritis, but now I can get up and I can walk without any kind of help at all. The physio has been excellent. I've followed their instructions. I've done the homework, and I can now walk free on my own. My experience has been totally positive, and I encourage you, if you are thinking about coming to Fortis Hospital or India at all, I would highly recommend this place.
Hi, I'm Dr. Mohan Puttaswamy. I'm a senior consultant joint replacement surgeon here at Fortis Hospital, Managatta Road. Patient Laynette sought us out digitally asking for the solution for her hip arthritis. So she was recommended hip replacements in Canada, and she had done a research. We got email and we responded saying that we will give her a quality of surgery where she will need to undergo a bilateral hip replacement for her hip arthritis. Now, whenever we get international patients seeking out for hip or knee replacement, they have certain fears in their mind. They're coming to a totally different country. They're worried about quality of care. They're worried about the competence of surgeons. If there's a complication, how are they going to handle it? So being a JCI accredited hospital, it's kind of a benchmark for the patients to understand that, we meet European standards or even most of the international standards in delivering the quality of care to our patients. US training, my certificates from US, New York training, all of this helps in inspiring the patient to come to us, feel comfortable. Their barriers are not just scientific. There are a lot of fears, social, cultural, and our ability to inspire confidence and give them the necessary confidence to say that, we will deliver the same quality of care they would get anywhere in the world at a value which is much affordable compared to any country in the world. And that most likely inspires our international patients to come and seek care with us. And that's exactly what happened with her. And psychologically, she was ready for both her hips at the same point of time, but I had to sit down and explain that, doing one hip after the other is very important. And my aim has always been to have the lowest complication rate. So I did explain to her that we use a slightly different approach. The dislocations are going to be great. The leg length we'll have to manage. So at the end of it, she's been an excellent patient. Rehab protocol to the T, and now at the end of both the hip replacement, it gives me so much happiness to say that her pain is completely disappeared. She was walking normally, and that's the goal. The idea of Fortis and our values has always been to have great patient results, delivering extraordinary care at a value proposition which is very helpful to our patient. Now, as a hospital where we have introduced multiple technologies like robotics and navigation tools and great operating environment, will help us deliver further quality of care at a very reasonable value proposition to our patients. Thank you.